not know, I'm the new chair of CPMT for the city. And this will be my first active duty today, this afternoon, on September 15th at 3:35 in the afternoon. Welcome, everyone. I am also going to read a statement on behalf of Albemarle CPMT, which reads as follows. This meeting is being held pursuant to and in compliance with Ordinance Number 20-A16, an ordinance to ensure the continuity of government during the COVID-19 disaster. The members who are electronically present at this meeting are, and I'd like you all, if you are a member of CPMT Albemarle, to say your names now.
Nita Davis, Region 10.
Mary Stebbins.
House. Oh, sorry.
Mary Stebbins, Albemarle Social Services.
L'Oreal's house, Albemarle County in general.
Kevin Kirst, Albemarle County Schools.
Aaron Callis, Charlottesville Albemarle Health Department.
Krista Gallio, 16th District Court Service Unit, Programs Chair.
Thank you. The opportunities for the public access to and participate in the electronic meeting are posted on the Albemarle County website at www.albemarle.org/community/county-calendar. I lost you. And that's it. Do we need to continue to do introductions? I don't think so either. Let's move along in the agenda, if you guys have that. So we're on the review approval of agenda and consent agenda, which includes approval of the August 2021 minutes. So this time, do I have a motion to approve the minutes from the county?
I'll make a motion to approve the minutes for the county.
Second.
All in favor?
Aye.
All opposed? Was I supposed to do discussion before that?
And just a reminder to say your name if you're doing first or second for the minutes.
Did anybody want to discuss the minutes since I skipped that part? Okay, let's see if I do this better for the city. Do I have a motion from the city to approve the minutes from last month's meeting?
It's Ashley Reynolds Marshall. I so move.
Aaron Callis, second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? All right. The other thing that we need to do that again for is approval of the August 2021 financial reports. We'll start with the county again. Can I get a motion to approve the financial reports for the counties?
I, Nita Davis, make a motion to approve the financial report for the county.
And L'Oreal's house, I second the motion.
Any discussion?
Yeah, I just wanted to bring back up, I think it was talked about when Phyllis was here about just pointing out the non-mandated services funds that we have that the county hasn't used any of for well over a year now, I believe. And I think, I don't know, I don't have the historical knowledge, so Jennifer, you might need to help me out, but that was previously used from DJJ, is that right? In the past, and that's, so Krista, do you know, is that just, do you have other funds now that are available for those services, or?
Yeah, I mean, we do have the DJJ Continuum funding available, whereas it wasn't quite as readily available as before. And I mean, we've been using CSA, but again, with COVID, we haven't been using nearly as much. So I think it's a combination of us using continuum funds, COVID, as well as lower caseloads for probation.
Yeah, and I know in the city, I was looking, we've certainly, used it sparingly. And I was just looking at the financial reports, and it looks like we've had one case in the past year, and it was a placement. We haven't had any, from what I can glean from the reports, any community-based cases.
Right, and I think the majority of placements that we've done throughout the past year have probably gone through Region 10.
Yeah, and even the one placement we did have, it looks like it was an A&D placement.
Yeah, and most of them were deemed as 10 cases, so mandated funding was used.
Yeah, I think the conversation we had before, and I'm not sure where it was left, was about, whether we would continue to use non-mandated in the same way that we have been, or, we would open it up to other cases.
So I think, sorry, go ahead.
Oh, no, I was just going to state that without Martha being present, that's something that I would not be comfortable discussing without her input.
Yeah, absolutely. I think part of what we just wanted to bring to CPMT is because this sort of started back when Phyllis was still on CPMT, the whole discussion around the fact like the county hadn't been using non-mandated at all. So it was really just a question of having a conversation about whether you all are interested in sort of expanding how we're using non-mandated. And if you are, I think the next steps would be to have the conversation with Martha to kind of see where court service unit is at with, if we were to do something like that. We originally set those funds aside specifically for those guys because when they contributed their money into CSA, they ended up being the ones that were not considered mandated, which just seemed really unfair. So CPMT back then agreed to protect those funds specifically for those guys. But because there hasn't been the usage, I think there's a question of, because they've had new funding made available to them. And, originally we were thinking maybe it was more related to the pandemic about why the usage had been reduced. But because it's been, for the county, we're going on about 1.5 years of not using it at all. And so we're just sort of bringing it here to say, are you all interested in potentially looking at expanding how we use those funds? And if so, like I said, next steps would be to have that conversation with Martha, see what she's thinking, and then maybe bring something back here to just figure out how to move things forward. So it's really a question of whether you all are interested in looking at that and maybe doing something with it.
I mean, I think so. I am trying to figure out how that happened, and well, Martha could speak to it more, but I thought, it was a lot of treatment placement. And so based on Krista saying that usually happens through Region 10, I'm thinking those kids who needed treatment now are qualifying for CHINs coming through ICC and using CSA dollars, I guess.
Well, and it just seems like the past year, it's been a lot of treatment related placements that have just been going through Region 10. But we don't necessarily have all treatment focused placements. So I wouldn't want to lose the funding for the placement in the future, because our DJJ continuum does not actually cover residential placements for probation kids. So we would still potentially need an amount of non-mandated funding to cover those kids who didn't necessarily qualify for mandated funding.
That makes sense to me. And that I would assume that COVID played a big role in the reduction, because the reduction in treatment beds occurred over COVID.
Yes, COVID definitely played a role.
Well, I'm happy to reach out to Martha and had just start a conversation to see what she thinks in terms of future use of these funds, and if that's okay with you all. And then we can, after that conversation, can determine if we need to change anything or just leave it as is, if that works for you guys.
Where's the best place on the next agenda to revisit that topic?
That is a good question.
Would that then continue to go as a discussion point under the approval of financial reports? Or does that go under review of system functioning and activities?
I think it could go under system function or even other business.
Yeah,
Since
maybe,
under system function is things that are ongoing to me.
Yeah.
and maybe it can be a new item. Cause I think some of those other ones are kind of standing items. I don't know that it fits under any of those. So maybe it just needs to be an F or an A, and we move everything down, or however
Yeah.
we want to do that. You can just say, use of non-mandated funds.
Sounds good.
Okay. So we had a motion and a second to approve the August financial reports
Could I
for the
mention
county.
one?
Oh,
Can I mention
sure.
one other thing?
Of
Yeah,
course.
there's two reports, if you notice, for August, and one's fiscal year 21 and one's fiscal year 22. So it's showing how the different funds are used on the different fiscal years. I do want to point out fiscal year 21 looks like we've gone over the local budget. So I know that we have to work that out, but just so if you look at the right-hand side, we've appropriated for local general fund 1.8 million, basically, and the funding expend was about 2.3. So it's just important to point out that will be adjusted. I'm not sure, there's no use of fund balance, but that's something that the budget offices work out. But I just wanted to mention that on the record. Thanks.
Thank you.
Yes.
All in favor of the approval of the August 2021 financial reports for the
Aye.
county?
Aye.
Any opposed? Okay. For the city, do we have a motion to approve the August 2021 financial reports?
It's Ashley Marshall. I so move.
Is there a second?
Aaron Callis, second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? All right. Thanks, everybody. So we are now into the action. We met as the new CPMT chairs and CSA coordinators, and Lisa got together to plan for this meeting. And one of the things that is written in the policy manual discusses the frequency in which Nita and I are to take turns chairing each meeting. And so the way the original language states that we would have 6 months of one person chairing, and then it switches for the next 6 months, the other person would chair those meetings. And when we talked in our meeting, Nita and I agreed that it would probably be best in our sort of bigger picture of our purview that it would probably be better for us to switch off rather than to have a chunk of chairing responsibilities. And so I don't know if someone needs to pull up the manual in order for folks to see it, but we'd like to strike the language regarding the chair frequency and just leave it at the statement where it says that we will take turns. And that's something that we have to take action on. Does anybody have any thoughts or discussions about that? Okay. So we just need a motion to strike the language about frequency in the policy manual.
This is Aaron's motion to strike regarding frequency in the policy manual.
Thank you, Erin. A second?
This is Mary. I second.
Any further discussion? All in favor?
Hi.
Aye.
Any opposed? All right. Thanks again. Now we have a review of system functioning and activities. FAPT update. Who would like to go first? Rock, paper, scissors it.
I can go first for the city. I don't know that we have much of an update from last month. I actually feel like we're seeing fewer cases. It feels like we've been able to skip weeks. You know, I would say every 6 weeks or so. But other than that, I don't think there's any other update from last month.
And I would just say for the county, the only thing I would say we've seen an increase in is the number of CHIN's parental placements. Definitely seeing more of those cases coming through from Region 10. So that's probably the main update that we would have for the county.
Any other thoughts, comments, questions about FAPT? All righty. So now we're reviewing the routine foster care expenses. I'm going to break character here for a minute. We got to vote on this? Okay. So we have the review of routine foster care expenses and FAPT approved expenses for the city and county. Any questions or discussions about those?
This is Lori. There was just, it seemed like one of the files, the zip files, was you can only open it if you had permission. So I just wanted to note that. So
You know if that was the city, that was for the county?
I don't, I'm not sure. I
Okay.
think it was county.
Okay.
County.
But we can definitely check on that to see what happened.
All right, CSA coordinator update.
I don't think we have an update that isn't already discussed somewhere else on the agenda today.
Same for you, Jennifer? Yes, okay. So we'll hold those discussions to later in the agenda. We are now on any OCS communications.
Yep, so for this, there was the one administrative memo, which just had to do with the reimbursement of the CSA state pool refunds. And so this is something that would be handled out of, for us, the business services, and this is just where we would credit back if we got any sort of collections for parental co-pays, or if a child was had first come into foster care and they weren't 4E yet, like offsetting those things to make sure that CSA gets reimbursed. And so I feel like both the city and the county do a good job of tracking that. So I don't think that's really something that applies to us, but it is something they must have found in other localities during the audits. So they were just sending this out as a way to let folks know to check that sort of thing. The other one is the two public comments. So OCS, you guys may have seen that one is for FAPT and one is for family engagement. And so both of these items are really things that program is focused on. And so the public comment period is open through November. So it may make the most sense for this to go to program to look at our local policy, what they're proposing, and then just to see if program would have any recommendation about whether we wanted to make a public comment. And then that could come to you guys to make these sort of official public comment if you wanted to do that.
And the public comment can even be that you're in support of having a family engagement policy. A few years ago, they sent out a memo saying localities had to have a family engagement policy. So this seems, somewhat a little bit redundant, but, we have one incorporated into our local policy manual that, reflects what we do throughout our FAP process and our CSA process. So maybe they were finding other localities weren't being as engaged and we have a unique kind of structure in that, the planning is done with the team of people, through the case manager, not at the FAP meeting. So if you read it, it might just keep that in mind while you're reading it, that our structure is a little different than most localities where the plan is being made at the FAP table.
All right. Program committee update. Krista, you're up.
So unfortunately, I had a last minute meeting come up for programs, and I know Jenny was covering most of it for me. Katie and Jennifer, do you guys have any updates? I had requested updates, but I didn't hear anything.
Yeah, we can give an update. So the two main things that program's really been working on are the satisfaction survey. The county's been sending that out for a couple months now, Jennifer, right? And I think we said we were going to look at the results by quarter. And so I think October's program meeting would be the first time that we're looking at the results for the county. The city started this month sending out the surveys. So we'll have more feedback about that probably at next month's meeting and how that's going and if we're getting responses and what those responses are. The other thing that program's working on is looking at UR on mentoring. And Region 10 is ready to start doing that for us. Jennifer and I were tasked with getting a list of cases together for a sample. And when Jennifer and I met to talk about how we would go about doing that, we really felt like, so the way that we need to do it is, the way that we can access that information is looking at purchase orders that have been set up with the standardized service name of mentoring. And I think what we realized and what we were kind of worried about is that given where we are in the fiscal year, not all providers have been approved with their provider agreements. And so if there isn't a provider agreement, then we don't set up a purchase order for that provider. So we wanted to wait another month or so to make sure we're capturing as many cases as we can, because we're basing it on cases that have purchase orders set up. So we are gonna still do that. We just wanted to make sure we're capturing, a good sample or as good of a sample as we can. So that's where we are with that. And I think those were the main updates that I can remember.
Thanks, Katie, for doing the update. I appreciate it.
Yeah.
I had a question about the satisfaction survey. Is that at some point going to replace the FAP survey, or is it in addition to the FAP survey?
We talked about that a little bit because they do measure different things. And I think there's interest in perhaps keeping both. I think we decided we were going to go back to the respective FAPs and say, do you want to keep doing this? Is this helpful? Is this not helpful? Because the FAP survey is really about the FAP meeting and that kind of process. And then the satisfaction survey is about the services the family's receiving or the participants receiving. So they do kind of measure different things. And we've continued to do both. So yeah, we're just kind of getting feedback from FAP at this point. Unless, you know, and again, if we need to keep doing it, if the CPMT says, yep, keep doing both, that's what we'll keep doing. But I do think there's interest for FAP to continue to get that feedback.
One of the things that made me think of is if we learn, because the satisfaction survey is done electronically, correct?
Yes.
And the FAP survey is done pen and paper, correct?
Yes.
And so if there's some sort of learning that happens that we per ratio get more of a response with the electronic survey, perhaps the FAP can take that into consideration and change theirs. And just in the spirit of not over surveying the people that we're serving, is there potential for the two surveys to live as one in perfect harmony?
Perhaps. Yeah, I think those are great ideas.
Other thoughts or questions from the group about program and what they're working on? All right. We're getting to some discussion here. All right, we have other business. There are three important conversations that we wanted to have around the bullet points around our work plan. The first one being financial reporting. And I think at our last meeting, we talked about the financial reports that staff come and do a presentation quarterly on sort of the state of things. And I think there was some consensus around, you know, what are the major takeaways from those financial reports? What is the learning to be had? And the group sort of felt like we needed some additional sort of support or guidance to make sure that we're looking at all of those boxes and numbers and making meaning out of those things. But before we invite the presenters to come back and make meaning of that data for us, we wanted to make sure that we were giving them some pretty specific questions that we wanted to have them answer. So for example, is there data in those documents that we receive that are more important than others for you all, from the places that you sit, from the perspectives that you have? Are there certain things that we want to glean from those presentations that we can be specific about?
So I will say I talked to Cheryl about these reports and sort of how they came into existence, which was well before my time. But what she said is at some point CPMT had actually gone through the process of changing the reports into making it more of what CPMT wanted to look at. So that cover page with the pie chart is something that was created to try to help, because before I guess it was just all the numbers. And then CPMT went through the different items to say what was important. But what ended up happening is, you know, the respective agencies had different things that were important to them. And so that's how they landed with all of the things that you see on there. So I think part of the question is that continuing to be the case now? Is that where folks are at, that you still feel like the things that are important to you may not be as important to other members? So I think that's part of the question. The other piece of it is, you know, there are certain requirements set out that CPMT is responsible for, that you guys have to be looking at those things. And so there's some piece of this that we sort of can't get away from, that you have to do. But for the things that are parts that were created by you all at some point, it may be worth just revisiting whether you all feel like that's still helpful information or not.
Yeah, I remember those days. It was a long time ago, but I was part of that group, and I don't want to tag anyone else. You each have to own up for your own experience levels. But I would say that is exactly how we did it. We looked at, especially that cover sheet, right? We did it in layers, and it was, what do you want to keep? Like, we actually got out, I think it was like pens and markers, right? Like highlighters, like, what do you want to keep, and what else do you need? So just to start, right, where does my eye go? And I do get the here, and it would be important to highlight here's what we have to, here's our responsibility. This section has to stay because that is our codified responsibility to keep an eye on. I think that's important, but I'll just start from the school's perspective. My eye always gets drawn on the cover sheet over to the right, where it has the breakout, where it's type of funds, the appropriation, funds spent and encumbered for year to date, and then the percentage. The last edit that I was involved in is that line that says fund balance. And only because I'm stepping back strongly into this role again, would be to check with Kevin Wazlowski and go, yeah, we've been working for years with Lori's and her group to build that fund balance up, and to see zero there, I start to tear up a little bit, because it's been a pain, right? It's been something we've so painfully focused on each year to build up that fund balance. So I'm just throwing out there, if anyone's like, oh, we could get rid of that box, and the box right down over on the right that has the schools and appropriation there, I'd say, no, let's keep that. Plus, it's a very quick access to what each group, right, is spending, where we're at. And Lori pointed out this morning, right? And just a little this morning, where am I? Just a little bit ago, that the percentage, very quickly, our eyes go right there. And yep, 111%. So I want to advocate that is one of the strongest pieces. I like the pie charts too. Just how much is special ed? How much is foster care? How much is other? Just to start the conversation going. But I do believe those additional sheets, not much utility from the SPED side, but I do recognize it may be part of the responsibility piece. So that's my 2 cents.
And I think from the responsibility side of things, if I'm responsible for looking at certain data, I want to be able to know what's cause for concern, what's cause for celebration. And so for me, it would be helpful if Kevin and Bill would say, like, here's like a green, yellow, red, sort of how we see this, maybe historically, where we would like to be, and how to make meaning of that. If I have to look at it anyway, rather than checking a box, I'd like to know, is this a good thing? Is this a cause for concern? Should we be talking about that a little bit more? Because for me, even though I can't technically say I'm new to this group, making meaning out of numbers is something that I'd like to do better at. And if we're already here with these collective perspectives and expertises, we might as well like use it to look with our data brains together. And I know that there's folks on this group that really love numbers and could really be an asset to really think about, okay, here's cause for concern. This is actually a good thing because we were at this point last year. Here's what happened if the fund balance does go to zero. These kind of conversations I would like to have here.
So Misty, if I can ask, one of the things that I've done as the year goes on with that little, especially the little box there on the right, on the front page, is I have to pull up the same exact time last year.
Right.
And the one before that. So I don't rely on Kevin to do that, but that is something I instinctively do.
Right.
And everything's dated. So I like that perspective of, are we sinking, right? Is it a sinking ship, or are we floating and really solid? And there's no way to know without context. And I think in the past it was, it would get so complicated to put into the form, right into the report, as much as maybe historically someone shares or posts. But I do want to throw that out that I agree, but I'm not so sure the utility of folks somehow building that into the report as much as us pulling up some historical documentation.
Yeah, I have a suggestion. I like both. I mean, sometimes too many numbers don't do anything for us, right? And so maybe it is, and I don't mean for another cover sheet, but I like what Misty said about cause for concern or highlight, these folks that are really close to the numbers, like Kevin, they know what's concerning here. It's buried in the page, for a lot of us, right? We're looking around going, is this good, bad, indifferent? So it's almost like some kind of a statement by those that are really close to the numbers to just,
Yeah.
cause for concern, celebration, red, yellow, green, this is great. This is cause for concern. This is what you need to watch. I think some simple words to go with the numbers, or even if they highlight, words with highlights, red, green, yellow, on the numbers so that we can find our way there. Because I feel like it's very complicated and it takes me a while to digest it. And I'm a person who's been close to numbers for much of my career. So that I just think it's an additive, but I think it would be very useful for us that someone helps point it out for us, because there's a lot of materials that we have to look through for these meetings.
For those for people who haven't been around, weren't around when Kevin was around, when these reports were made, I mean, is it helpful to completely back up and have Bob or Kevin come explain what these reports are even showing us? I mean, do we feel like we have that down? We just want to pick out what's important to us? Or would that be helpful as a place to start?
I like both things. I really like what Lori's describing around just highlighting yellow, green, red, doesn't have to be words throughout. But I mean, I'll be honest with you, when he goes over it, I'm like clicking back and forth and trying to I have never figured it out. And I kind of was around when Kevin was there, but I'm not numbers, and so I would love for someone, even if they just stuck with that summary sheet that we're talking about, and just tell me all those pieces. And then, I'm not mathematical. I write it all down. I really would need that, which I could get separately if other people are all on it. But that would be useful to me. And then just as a matter of course, asking them to red, green, and yellow things.
I do think,
as someone fairly new, I would love to have it explained to me, because my brain doesn't do numbers very well either. And so I always feel like I can read a little bit of it, but I always still feel confused.
Yeah, and I agree with Kevin. I went there on that side that Kevin did. Spending more money than you have, that's a red line. So for all of us, that box seeing 111%, you don't spend more money than you have board appropriation for. It's kind of like the rule number one. So that's always concerning, to those of us close to that, because if there's no fund balance, and I don't know why there's a 0 in the 21 appropriation and nothing in the other one, that's where you go, right? That's why you have fund balances, because you have to have a rainy day kind of opportunity. So I do think that particular box, if nothing else, we need to know where we're at on those before year end, and I know that a lot of costs come in after the year ends, right? Because it's July is a new year, and that's why you had 2 forms here. But I think if nothing else, that's an area we could start.
And as someone who's extremely new to this, very, very new, I understand I am not an anti-numbers person, but number one, I agree with Krista. I would love an explanation just to ground me a little bit more into what I should be looking for. And I really love Misty's idea of a dashboard. That is a very non-property thing to try and create. but it is very helpful to know, like, again, as Lori just said, if all of a sudden we have spent over 100% of something, that one I can easily recognize there is a problem. But if it's something where maybe the problem is that we've only spent 30% of something at this point and we should be higher, or if the issue is that we are right at the cap and we have 6 months left in the fiscal year and this is the only thing that funds this widget or this group of people, again, at this point, I don't necessarily know what that is. So that would be really helpful for me. And I do like, however, the way that it is laid out in an already almost dashboard style. I appreciate it. I like the pie graphs. Thank you for the pie graphs. And so I do like the way that it is now, but if there could even is just a highlight on it that says like red, yellow, green, orange, nuclear, whatever, that would be super helpful, because then if I don't get it, I can always ask an appropriate question.
Yeah, maybe we need more pictures and colors.
I'm a big why person, so and it's tied to efficiency. And so, you know, if we are required to look at something, I'd like to know why that is. Again, to inform what I'm supposed to be looking at. If I'm going to be on the hook for doing it anyway, I would like to know why are those the ones that we're required to look at and what's their significance. So some sort of like orientation to, here's why we have to look at these numbers. This is what you're supposed to be looking for. The categories of red will be these things. The categories of yellow will be, these are things that we're puzzled about, and maybe you guys can problem solve this a little bit, some cautionary. And then green means this is a really positive trend that we're seeing. Because I think those things, if we were to have been directed to look at that fund balance intentionally, we may have been able to put our heads together to problem solve that. So maybe we can make some influence somehow, I don't know. But the reason why it's under the discussion for work plan is because there's a specific goal area in our work plan that talks about that we wanted to know financial information related to the two localities. So we wanted to know how and what and why Charlottesville was spending this way, and Albemarle's how, what, and why they were spending in this way, and how do they intersect, and just to have more, again, problem solving around that. So it's really important that if we're going to look at that financial data and it aligns with our work plan that we said that we wanted to do, so we should be doing it. I think we have, and I know Jennifer's been furiously taking notes, I think we have a pretty good idea of what we want to go back and ask Kevin and Bob to do for us next time. So we're asking for some sort of orientation. We're asking for to maintain some focus on the fund balance chart, and some sort of designation of red, yellow, green.
So
Yeah.
for next, oh, go ahead.
I was just gonna say, we probably should define red, yellow, green for him. So if we all, because the way you said it, when like red, we know that's bad, right? To me, yellow, and this is just from the financial reports I get at Region 10, yellow is, it's approaching bad. You got to do something. That's what yellow means. And green's like, wow, it's going great. Better than expected. But I think we want to tell Kevin that's what yellow is. You're going to be in big red if you don't do something now.
Mm-hmm. And I think Lori's suggestion to say, these are the folks that are closest to the numbers, and they already know in their minds what's red, yellow, and green. We just need them to say it out loud to us.
Right.
They know it. We just want to know it too. We want to share that celebration, concern, and panic with them.
I would say the only thing I would ask too is for that yellow, it's natural for us to look at that yellow of, let's say we're approaching, again, 90% of total amount to expend in month 3. But I know from running grants myself, it is equally as concerning when I had to get my DB staff to spend a ton of money at the end because they didn't buy enough supplies. And so for me, is it comfortable for everyone that yellow means we need to look at this for a reason? Either we're approaching nuclear reason, or like, please, can we help someone with these dollars?
Can I add also, maybe it's a different color. I'm gonna throw out blue. Is like, we should be discussing this. So for example, like, if we're noticing a trend, because part of our charge is to kind of like, the way that I see it is sort of to stay abreast of certain trends that are happening in this system of care. And so if there's something that's like that, you know, if another experience that these folks that are close to numbers have is like, well, that's weird. I wonder what that's about. Where we made a shift in where the money is spent, maybe, for example, or not being spent.
You're raising a good point about trends, because I don't, you know, you heard Kevin say, I have to go back to this time last year to see, you know, you can hear a little bit about trends that I don't see in this data, not to ask these guys to do more stuff, you know, because there's a lot of data here, but I do think that the trend concept isn't that clear. It takes a little digging for us. So to your point, maybe trends are real important. You know, if we see there's some cost that's just escalating, we may not be able to do anything about it, but it's good to tell our funders, right? That this is a cost that's been going up, you know, 500% over the last 3 years. So I do think there's some trend data missing, and I don't know if it'd be more a question to the authors of this data to say, how easy would that be for you to, you know, to give us some trend information, or to your point, check the trend information and always let us know each time you turn a report in, is there any trend situation that's concerning to you? But I do think that trend information is hard to see in this.
Maybe it's, and I don't, sorry, Anita, go ahead.
I just would say, like, for me, not for the rest of the group, but like, I just would like to get the orientation before I ask anything. Because I think once I understand it, because I agree with you, Lori, the trends aren't there. But I really, before I ask for what trend I want to see, I need to really understand it. There is a guilty part of me that's like, gosh, if you looked at it long enough, you'd understand it, Nita. But I haven't. I want to be taught.
And I'm sensitive too, by being someone that has had to put things together for audiences. You know, let's not over ask, you know, because we like all of a sudden, you know, these people do all these things. You're like, oh, that's nice. You know, you go on to the next topic. So whatever we do ask them to do, it really should be something meaningful to us and not just nice to haves. Yeah.
Agree. I think also they typically present city first, then county. And I wonder if we'd be able to see if they're highlighting the numbers, if the dashboard looks the same for city and county. I know that maybe they could put those two together somehow in the way they present it, rather than having to toggle back and forth on our own. But that could be just me needing to take more time to toggle back and forth, and not fair to ask of them.
One other thing I was going to say is, could they, when they do the orientation, talk about when they saw trends before or saw pieces of the puzzle that were either overspent or needed some other adjustments, like not a long thing, but how that got fixed and who fixes it? Does that make sense what I'm saying? Like, if you saw this piece, how did you do it before? We're going to see the red, yellow, blue, green, orange, yellow, violet. You know, just some little synopsis. If we saw this before, like, I know sometimes monies might be behind because you're still waiting for payments and things to come in, right? In some way, shape, or form. But I'm just thinking some little bit of, you know, how they don't pull all their hair out by the end of the year in a fiscal year. Or they do pull it out and put it back in, you know what I mean?
Thanks everybody for digging in on this topic. The next topic that we have to discuss is really guided by Katie and Jennifer. I'm sorry, go ahead.
Sorry, before we move on, so I'm just thinking like next steps. Do we want to ask Kevin and Bob to come to the next meeting to do an orientation? And maybe like Jennifer and I can reach out to them to say, this is what the discussion was at the last meeting. Would you be available to come and kind of give a overview of what we're looking at here as a place to start, and folks, you know, provide some feedback on what we'd like to kind of give attention to and how we're able to do that, and maybe define some of those benchmarks or whatever for you guys. And do you want us to reach out to them for the next meeting?
I have a question. Also, could you, I say yes, but I also would wonder if they could tell us what's the mandate, you know, what is the mandated pieces that we must see? And what is the nice to haves, so that at least we know the difference.
Yeah. Right, I just wanted to make sure we were clear about that before moving to the next item.
Katie and Jennifer for reaching out to those folks and offering an invitation for next time. Do you all also want to discuss the template of the work plan?
Yes. So I think this came up at the last meeting a little bit. Maybe we touched on it. It seemed like we were kind of having a hard time maybe following along as we were having a discussion about the work plan. And so after that meeting, Jennifer and I got together to update the work plan, and we were also really struggling with the format and the structure of the plan and how to update it. We kind of felt like there's almost like too many boxes, and some of the who, what, when, where, how, next steps didn't make sense for some of the goals. And so we wanted to bring it to this group. If you guys are okay with us reformatting the work plan, or does this really work for you guys? What do you guys like about it? What do you not like about it? The other thing Jennifer and I talked about that would be nice is having some sort of running narrative on what has been accomplished or what has been done. You know, when we have audits, the auditors look at these work plans, and we're finding that we're having to say like, okay, here's the May version, and then we update it, and we're like, okay, here's the July version, and then we update it. It's like, okay, here's the August version. And so if there's any way to make this kind of a running document to a certain extent until we accomplish a goal and get rid of that page, then that would fall off. But we were also just thinking that might be nice. And then if somebody misses a meeting or is a new member, they have kind of a little history of what we've done so far in regards to that particular goal. So just wanted to get your feedback on those things before we proceeded and kind of updating the plan.
Definitely need a new format. That one didn't work.
There's too many 5.1.2.b.
And I like
Yeah.
what you're describing, that we're updating each activity as we do it, so we have that history. It could be in Excel, however, whatever you think works.
Yeah, I like that idea a lot.
I think it needs to be user friendly for the folks that are responsible for using it, and that's Jennifer and Katie. And so if the current document makes their work more difficult or challenging, I don't think we should just keep it at. And I think that they're able to create a document that works for everybody. And I like the suggestions that you've made so far.
And I almost wanted to make a joke of red, yellow, green, blue. But you know, it's not a bad concept, right? It's not a bad concept for our performance as well as our numbers. So some, you know, it could be that when you see that report, you see, you know, which ones are we really falling behind on, you know, some way that we know, hey, this one's good and done, or we're really good on this and this one we're not. So don't want to go back to the colors, but you know, it's not a bad idea.
Well, one of the columns on the current plan is like completed or in progress. And we were kind of like, well, if it's part of our plan, then it's in progress, right? Once it's completed, it's it's not really part of the plan, I guess, unless, until we talk about it again. But yeah, if there's some way to do that, I think, and that was part of, what we struggled with is some of these are kind of bigger ideas, kind of bigger concepts, and some of them are kind of more measurable, short-term, kind of short action steps. But if you all trust us, Jennifer and I will get together and come up with something and present it to you guys.
And I just have one other idea. When we set goals or when we think about things that lead to this work plan, this is something I learned from ICMA, and I used to do strategic planning a lot in my career, but it was really weird. It was 3 simple words. And one was to lead to measurement is what are we going to increase? Then it's what are we going to decrease and what are we going to maintain? And it's like, if you can put your goals or your plan into those 3 words, then it's measurable. And it was something that stuck with me, through the years, that those are just great words for work plans or for anything that you do. We're going to increase participation, or we're going, and it does then lead to counting. So I just wanted to throw that out there as we think broadly about work plans. Just a nice little helping statement, because to your point, some get real lofty, some get real tasky, but if you use those words, you can literally pull it together sometimes. So just a suggestion.
Thanks, Lori. All right, so next meeting, is that when you guys think you have enough time to rework the design of the plan? Or do you need more time? Should we put it on the agenda to look at the new layout?
We'll probably keep it on the agenda, and Jennifer and I will get together and see, like, if we don't get it done by next month, we'll keep working on it. But we can keep it on there until it's resolved.
The last discussion point is again related to the work plan, and I don't have the work plan with me to pull up or share screen if that's helpful for folks. But we have some intentional language to look at diversity, equity, and inclusion in our work and in our organizations. One specifically around like member representation and organizational structure. Like there's some goal. Katie or Jennifer, do you guys have the work plan? Or should I pause to pull that?
I'm trying to find it.
So
I can share my screen probably.
So one of the things that we wanted to discuss here is how are we going to be able to measure progress in that? How will we know that CPMT members are taking an intentional look at diversity within their agency? How will we know that there are opportunities developed within program and fact? And so we wanted to consider for this group to discuss, could we have a standing agenda item that allows the opportunity for each agency, sort of like an agency update, but an agency update related to their own agency's work on diversity, equity, inclusion? And what might that look like or entail? So when I first joined program to fill a vacancy when Julia Rubarth left, one of the standing agenda items in that group is trauma-informed agency updates, I think it is. And folks kind of go around and talk about, are there any sort of highlights or what are they chewing on or working on in their own silos or their own organizations that really gets to this commitment to offering trauma supportive services. And I thought it was a really nice opportunity to be able to like highlight some of the work or offer some opportunities to others for others to join the other organizations. And so I wonder what that might look like here as part of our action steps, that our membership is taking an intentional look at diversity within their agency.
I like your idea. I think we should do it and see how it goes, right? Great. I think it'd be a great conversation.
We're looking for quantification. Often what I have seen more broadly, so this is definitely not department / agency specific, it's more organizational, but thinking about a diversity audit. So you're asking yourselves questions to see where the baseline is, and then determining within your association, organization, insert whatever you need, where you need to improve. So I would say, for me, thinking about what you all have, by the way, if you see me looking to the other side, I have a second monitor. I'm not, losing it yet. So, but, what I see is really great things to work on, but I don't know where anybody is. And so if you create a number, that may create either an unattainable goal or other things, but maybe that could be one of the steps for if quantification is where we're headed in this conversation of, you need to know the baseline of where everybody is. And then how they determine within their particular agency, how they feel like they can reasonably move forward.
And so Ashley, what you're describing, I'm just sort of, are you thinking like one of those self-assessment readiness grids like Georgetown University or some, but I think that would be a great idea because there's a bunch out there, and it would be good for us to use the same ones on our own agency as just a beginning of a conversation. Sort of where's the agency at? Because typically those self-assessments put you somewhere on the scale of readiness and action. Is that what you're describing, Ashley? I mean, I think it's a great idea if I understood it correctly, but you please feel free to be like, no. Okay.
No, that's exactly what I was talking about is a diversity audit. It's really easy to find frameworks actually for higher education. There tend to be a lot of them because they have some requirements that they need to do at this point. But yes, it's more of like, have we started this? Are we in the middle of this? Do we have all this?
Yeah.
And I like them because it makes you kind of pause and think about where you really maybe want to put, I know you have goals, but where you really also maybe want to put some focus in. And also it may give you an idea of small wins.
So the mental health, and I am on the ARISE committee for racial equity through the Mental Health and Wellness Coalition, and they've started to establish a resource list in the process of. So I'd be happy to bring one of those. But I'm not an expert on which one to use, but yeah, I'm happy to bring forward one that they recommend just for folks to look at.
The secret is if anybody tells you they're a Jedi expert, none of us are. We're all trying to figure it out because every agency is unique. Every community is different. It's like, I think, was it Justice Potter who said, dealing with certain things of trying to figure out whether or not it should be allowable for the Supreme Court. I'll know it when I see it. So if it works, then that's the answer until you get to move forward and become more advanced, but use what works.
I think the other part of this, and I don't know if we talked about this at the last meeting or not, is, you know, we're all talking about looking at it within our agency and sharing it with this group, kind of what each agency, where we are and what we're doing. You know, the other thing is looking within our CSA system. I think we had mentioned at one point, do we want a statement incorporated into our policy manual or our webpage or whatever, because we don't have anything like that as a CSA program. So just something else to think about, you know, as we're looking at each of our agencies, but also, is there anything that we need to do collectively for CSA?
Katie and Jennifer, is this goal sort of set and submitted and set, or is this something that we can rework this goal with some of these additional discussions?
This is the CPMT's plan, so you guys can do with it whatever you want. We intentionally revisit it once a year, but I mean, I think it can morph and develop as you all see fit.
So I would propose, like, it says encourage CPMT members to take an intentional look. I would get real granular. And is it okay if our next step, we look at a readiness assessment as Ashley was describing and just discuss, like, who fills that out? Do I need Lisa to fill it out, or are you okay just from my perspective, you know, and just have a discussion as a next step? Because I understand, like Mary, what you were describing about TICN, I feel like we need more activities for it to be a meaningful conversation. Because I can bring you a list of 20 trainings that were available at Region 10 related to DBHDS. I don't know that that is as meaningful kind of conversation.
I also think the goal is a little bit limited because it only talks about diversity. We're going to ensure diversity within the CSA system. I'm not really sure that that really captures what we meant. We talked about representation on FAPT and program and CPMT, that we wanted to be more reflective of the community that we're serving. But I'm not sure the top goal there, ensure diversity within the CSA system, really truly captures what our conversation was. It was more about my eloquent words are escaping me. I ran out of them, but it's more than just diversity.
Yeah.
We're looking at our place in diversity, equity, and inclusion, like CPMT's CSA systems place, like you were saying earlier, Katie, is that our goal is maybe to investigate our relationship to the CSA system with regard to equity, diversity, and inclusion. Which means, to your point, Katie, we do kind of have to look inward in ourselves. We have data that talks about who we're serving and where those disproportionality may be occurring, but we also need to be, if we're going to be the ones that are responsible for looking at this data with our lenses, we need to be looking internally at ourselves and our agencies, I think. Does anybody have any other ideas about what the goal should or could say that more represents our previous conversations around that when the goal was initiated?
The way I remember it, Misty, it was a reaction to the disproportionate impact on people of youth of color. That it was a reaction to that, like, no, and it was, and then the diversity piece was described, but like when go back to Lori's decrease, increase, and maintain, like we could revisit, like what did we want to decrease the disproportionate negative impact on youth of color, you know, or you just working through that in a more thoughtful way.
I like that, Nita. So, we have about 15 minutes left, and I'm just thinking about how to transition to, you know, agency updates and wrap ups. So for next steps about this, the original idea that was proposed is, should we have a standing item to really talk about what our agencies are doing? It sounds like we're making even more meeting than sharing our resources and what we're doing, but really looking at revamping this goal. And we might still have a standing agenda item that talks about what our agencies are doing, but maybe it's more related to a assessment tool that we're doing. Right? So for next meeting, let's consider reworking the goal 5 title to include some language around decreasing disproportionality in the CSA system. And some of our action steps will be changed. Is that accurate? So we'll come back. One of the action steps, it sounds like folks would be open to bringing to consider some assessment tools. And it sounds like Nita, you had suggested maybe sharing one of those. Ashley, I didn't know if you had one. I also have one that I've used as well, but it's related to food justice work. So we can maybe send those ahead of the next meeting, so we have an opportunity to look at that with the documents that get sent along. If folks have tools that either their agency have used as an assessment, and we'll have a discussion about which tool seems to be right for us. Anything that I'm missing? Any other next steps that are not clear? Okay, we can stop share. Yeah, here we go. Hey again. All right, thanks again. The last thing that we have on our agenda is to include any agency updates from CPMT members. So if we could just go around and share any updates from your agency that are things that you want us to know, things that you're celebrating, things that you're getting challenged with, or any sort of offerings that you want to make sure this group knows. Who would like to go first?
I will.
Okay,
So,
thanks, Erin.
I will just say that because I know we all are struggling with it currently, I successfully hired into a position for a public health nurse that's in our Nelson locale. That's huge because that was empty for a long time and just trying to fill the needs. So yay. And we're working on almost filling another spot. Yay. In the middle of a pandemic, as you all know. We're still working on the pandemic stuff. And trying to, again, increase services. I think I mentioned that in the last meeting, and keep base services going. So it is a bit of a struggle, but we're working to meet goals and outcomes. So, but those are little things to celebrate. Hiring. Yay.
Absolutely. Thanks, Erin. Who's next?
I can do Region 10 updates. We have been defined as one of the agencies that has to do a mandated vaccine by the federal Joe Biden proclamation. And so we're preparing for mandating vaccines. We've had vaccines available to our staff, but just like every agency, there's that 20-25%. So we'll be starting that process. We still do not have groups in person and outpatient, only individual in person by request. I'm trying to hold on to that even through this Delta variant. And we will not be able to open our women's center in the near future because of our workforce challenges related to having to stand up the facilities that house people already through wellness recovery, the Moore Center, and our multiple group homes for DD and MH. That just the workforce is not going to allow for that to reopen, even though we're very committed to it. It's just not safe. I think those are the latest new things, if you count that as new.
Lori, any updates from the county office?
Those of you that work in the county know that we are asking all employees to provide their vaccination status or be tested every week. So there's a requirement or one or the other. So we've set out that whole process. And we're on it. We're going to take it very seriously. The only other thing I'd mention, if any of you work with outside agencies, we do have a funding process for outside agencies to apply for county funding. We've started our orientations. We'll have a website up soon where people can see how to apply for different things. The new thing this year is ARPA funding. We are going to have an application process for ARPA funding in addition to our usual process for agency funding. So I just mentioned that to you if you all know people or know agencies that may be interested to check out our website. It's not quite up, but we should have it up by next week. So that's all I have. Thanks.
Mary, anything from Albemarle County Social Services?
Not that I can think of. I do just want to share one little story, sort of story. We do have an Afghan family that has arrived that they're not refugees, dad is a citizen, so they didn't go through IRC. And so basically it was up to social services to help this family get housing, job, housing, completely furnish the apartment, food, everything, you name it. They had nothing but the clothes on their backs. And so I just want to give a shout out to our agency because, this is out of the scope of anybody's job description that works for social services, really. But we got them an apartment, we got them fully furnished, we got them clothes, we got them food, we got them housewares, we got them towels, we got everything through donations and through, the amount of work that our workers put into this last week was unbelievable. I think I counted, it was like 15 of our workers were working on this in some capacity, and some of them it easily took up their entire week last week. So it was a huge undertaking, but they are here. They came on Monday and they are so incredibly happy and thankful for everything that we did. I just got an email that popped up that I just read because we just delivered the last of, they needed a couch and we just delivered that literally while we're on this phone. And I just got an email from the worker saying how excited they were and what a success it was. So it just reminded me of that. So I'm just sharing that even though we're incredibly understaffed and can't hire anybody, our folks are still pitching in and doing the good work. And so I just wanted to share that because it just really warms my heart to see them all come together like that. So I'm just sharing. And more Afghan families will be arriving, most likely, who are also not refugee status. So this will probably not be the only family we are doing this with. So
That is totally awesome.
Yeah.
What a success story.
yes.
From we, because we see all the refugees that come. So that is totally awesome. Thank you.
Ashley, anything that you want to share from the city perspective?
I have anything right now.
What about you, Krista? Any updates from the CSU?
I don't think we really have any updates. Again, we are down to 2 POs, Charlottesville and Albemarle. Hopefully within the next month, we'll be able to do some interviews. And then hopefully we'll be able to fill Ashley's PJ position soon as well, or do some interviews for that. But yeah, I think we're having the same struggles as everyone else. And Mary, it's really good to hear that story. Erica shared a little bit about it Monday during class. So that's a great story to hear. And great job for you guys.
Thanks, Krista. Hopefully you'll fill those positions soon. Kevin, anything from county schools you'd like to share?
Yeah, just, efforts to stay safe and stay open. No, just struggling the day-to-day that everyone shares, right? Having enough staff. We certainly have the funding, but not the people, but we are, forging ahead, doing the good stuff, and our kids look great, and they're back, and families are happy. It's just maintaining that safety stuff.
Absolutely. Kate, anything you want to share? Jennifer? I'll just share briefly that the Department of Human Services Community Resource Hotline is, as you can imagine, experiencing high call volumes, and we're trying to get back to folks as quickly as we can, but it's not nearly as quick as it needs to be. So we're working on sort of figuring out how we can get some extra hands in there, ears in there to get caught up on our call log, and so that we can kind of decrease our wait times. As far as our youth services program, our internship program is going to continue to be virtual this fall. We are still open for applications for city youth to participate. So if you have city folks that you're working with that are teenagers, send them our way. Other than that, I think that's it. We have the similar process at the city that Lori shared, the Vibrant Community Fund process. And so notifications, our application is open now. So we're underway there as well. Thank you all for your time, energy, commitment, ideas, feedback, solutions. Appreciate what you do. This meeting is adjourned.